So I want to just do a brief overview of one of the pieces that Judy mentioned in the report, which is the existing provisions in the Affordable Care Act to review, although not approve, health insurance rates. As Judy said, the federal reform law requires review and public justification of unreasonable rate increases. However, it doesn't require approval or give any regulator the authority they don't already have to reject, modify, or deny unreasonable rate increases. The way this has been interpreted is in an HHS regulation that was issued in December. We expect the final regulation to come out of HHS by the end of the month. The Affordable Care Act didn't define what an unreasonable rate was, and so HHS interpreted the provision in the law to mean that they would trigger review of any rate that was at a 10% increase or higher. So HHS set a trigger that would review either by HHS or the states any rate increase above 10%. The review would be done by states in most cases, but HHS would take over review if they determine that states don't have an effective rate review process. And the criteria for a rate review are largely administrative, and HHS has made it clear that they expect in most cases that states will be doing the review. If HHS reviews a rate, they will find a rate to be unreasonable only if it's found to be excessive, unjustified, or unfairly discriminatory. However, in the states, HHS has left the definition of what an unreasonable rate is up to the state. So HHS has set a standard only in those cases where HHS conducts the review. The second portion of this provision of the Affordable Care Act is the public justification provision, the provision that was supposed to publicly expose unreasonable rates by health insurers and thus shame them into doing the right thing. It's a tool, as both Judy and Senator Feinstein mentioned, Commissioner Jones in California has used to some significant effect by exposing unreasonable rates, although he doesn't have the authority to reject them. That said, it all depends on how good that public justification is, whether or not the bully pulpit can really make any difference in insurance rates. In the regulations that were, the draft regulations that were issued in December, HHS requires, in the case that HHS is doing the reviewing, a health insurance company to submit a rate summary, a narrative of what the rate increase entails and what went into it, and documentation, so the actual data that goes into a rate increase and the justification for that. In these circumstances, we think HHS has done a great job requiring full public disclosure, so it would allow any independent party to look at the data a health insurance company has used to justify a rate increase and decide for themselves whether or not it's reasonable. However, there's a big hole here, and that's in the fact that HHS has limited the amount of information that insurance companies will be required to make public in the cases that states regulate. So when a state is doing the review, only the rate summary and narrative, not the actual data that went into a health insurer's determination of a rate increase, would be made public. We think this is a huge hole and are hoping that that'll be fixed in the rate regulation that's coming out of HHS soon. Right now, some states require that information to be public already. Many states don't require it, and in fact require it to be confidential. And that's a huge hole in public disclosure. Finally, the last piece of the rate review provisions in the Affordable Care Act are the grants that it provides to states to improve their rate review. There's $250 million available in the Affordable Care Act to states to improve rate review. $46 million of that was already awarded in the first round of grants. And in my review of those grant proposals, 12 states indicated that they would be actively seeking strengthened authority to approve health insurance rates. One of those states was Florida, and they've since backed off and said, we're not going to enforce the Affordable Care Act at all, let alone seek additional authority for prior approval. However, we've seen in the face of these massive increases, some states saying, you're right, we need more authority to do our jobs. The rest of the money will be available in a second round of grants. And HHS has indicated that they'll be setting aside $27.5 million of that grant money specifically for states who seek the authority to approve or disapprove rates. So we think that's a good use of HHS's ability to encourage states to do prior approval. We can talk more if anyone's interested about Consumer Watchdog's recommendations to strengthen those rate review grants that HHS is proposing, but I'd like to just pass it on to Harvey Rosenfield.